Hey you guys, it's Melissa. I'm going to be doing a lecture on some test taking strategies for you. These are kind of general recommendations. It's not the end all be all of test taking strategies, but hopefully it'll help you as you go through your test and maybe you get to a place that you're like, maybe I don't know the answer, or I do know the answer, but I'm not completely sure. And it'll help you kind of determine which answer is the best answer or the test answer. Because that's kind of an important part, is what is the test answer. Most of you are going to want to go into your head and think, well, but what it actually does in the real world, and oh, and this and that and that and the other, and then that's where people get messed up. It's the test answer. So remember that as you're going through, okay? So give me just a second and I will open up and share my screen here. All right. So I always want to give props to the person who helped me do this. This is a PowerPoint that was taken from Amy Leach, who is our student success manager for our pre-licensure program. And she and I worked together quite a bit before, and she's really excellent at this also. So this PowerPoint is adapted from hers. So sometimes you'll see some crossovers on my stuff. I do the test taking strategies for the 3P exam and for the certification exam. And so if you see anything having to do with 3P, just ignore it, since for right now, you and I are talking about the board certification exam. Exciting. All right. So why are there certification exams and what is the point of them? Well, there has to be something that says you are safe to enter practice, right? We do the 3P exam to make sure you're safe to enter clinical. They do the board certification exam to make sure that you are safe to go and start seeing patients. And let me tell you, this is, it's basic. It is meant to do the minimum competency. So that is what it is all based on. I have written questions for this exam. I sat on the standard setting panel for this exam for the ANCC, AGA, CMPA exam anyway. And it's really like every single question we went through when we changed the exam back in 2014, we had to ask ourselves, is this something a new grad would know? And if the answer was even a remote no, if 1 out of the 10 people on that panel disagreed, then the test went out. So that's kind of the important thing to know. I don't want that to make you overly comfortable because there's a lot of information to know. But the big thing to understand is it is meant to do minimal competency. The other thing to understand is that you're going to take all 175 questions. I go through this a little bit more on next steps, on the next steps lecture, but you're going to take all 175 questions on your exam. It's not like your NCLEX exam where it kicks off after you've met a certain criteria. You're going to take the entire thing. So it's not adaptive like the NCLEX is. So what makes it different than other exams? And this is more for the board certification exam. And I want you to look at this, and you can think of it like Bloom's taxonomy or Maslow's or whatever. But the big thing is when you think about the body, it's a billion parts that create a whole, right? A whole part. And so a test question is doing the same thing. It's determining whether or not you have all of that information and can bring it in to answer one thing. So the first thing you have to do, the very base down here, right here, is you have to be able to recognize and recall facts. So you have to have the simple recollection that enterobiasis is pinworms, right? And from there, you have to understand what that means. Okay, my patient has enterobiasis, which means they have pinworms. Okay. Now, how do I apply it? Well, what do I know about pinworms? Well, I know that it's a, hemolytic infection in the gut, and that it is uncomfortable, and it causes nighttime itching. Okay, and then break that down into compartments. What do you know about it? Analyze it. It's like, I'm going to need to fix that. And who does it happen to? Oh, wait, it happens to children mostly. Why? Oh, typically because they always have their hands in their mouths. And is it contagious? Yeah, you're probably gonna have to treat the whole family. Okay, judge the value of the information or ideas. Now let's think about this. Who gave me this information? Are they a reliable source? Do I believe what they're telling me? Could there be another diagnosis here that I'm missing? And then you take all of that into account and you're going to combine them to make a whole new idea. And there's your whole idea you're going into to answer the question. Okay. And these questions for your 3P exam and your certification exams, they require you be able to put all of those building blocks together in order to get the exam question correct. So now that you know kind of what an exam question, is going to look like and how they're built, let's think about how you are going to build a plan to tackle how to study for this thing. Okay. I always recommend a review course. They're great. I have done Amalé's course for the family nurse practitioners, even though I'm an AGACMP. I have done Barclays multiple times. Both of them are great courses. There's some other ones out there, but they're the kind of 2 gold standards, and they'll guarantee you pass, or they'll let you take it again. And then you review your resources, your textbooks. Care on Point's a great resource because it's so bulleted. It's like, there's your diagnosis. Here's the most up-to-date risk factors, etiology, assessment, treatment, and plan. I mean, it almost reads like a soap note. And then review your lecture materials and handouts, whatever you still have. But I do really recommend a review course and review books. I don't have that one there on the slide, but a review book is really helpful, especially for people who do best by taking tests and reading rationales, because most of them will have a really good discussion about the test you're going to take, if it's an F&P review book versus an ACMP review book, or and then it'll have sample tests at the end and sample board questions. And that's what you really need to do, is practice taking questions. And then you're going to think back to yourself on previous exams you've taken and your different studies here, and what did you do your best on? What are your strengths? Like mine's cardiology. Mine cardiology and pulmonology. I got that one. Neuro, not my best subject. Urology, kind of, sort of, maybe. So I know that as I go to build my plan, I am going to have to choose the thing I'm not good at first to study and go down to the thing I'm good at. Because if I start to run out of time, which we're going to create a study plan, so hopefully we don't do that. But if I start to run out of time, I have at least hit on the things I know are my weaknesses. So it's really important that you can, be honest with yourself and rank those things and create out a study plan. I'm going to show that to you in a minute. The other thing that I'm going to call you out on is the same thing I have issues on. And that is, usually if I'm not good at something, a lot of times what that has to do with is that I don't find it all that interesting, or I'm not interested in it, or it's not something I care about. And so when it's not something you care about, or you're not interested in it, you don't really want to study it because it bores you. I know all my neuro nurses out there are going, oh my God, how can neuro bore you? Well, it does. Okay. Don't like neuro. Love cards. So just be truthful with yourself and think, this is a blip in time. It's a moment in time. Maybe I never have to do this again, but honestly, you're probably going to need to know it, whether you like it or not. So you might as well just hunker down and study it, and realize that the more you dislike it, probably the more you need to know about it and the harder you need to study it. So then you're going to create a study plan. And again, I'm going to show you that. And you're going to have to make time to study. And I know everybody's like, oh, I'm going to study. And then you think you're just going to throw it in there. No. When you're getting ready for this exam, you want to pass it on the first time. Do not be one of those people that goes in there thinking, I think I'm going to just go take it. And if I pass it, great. And if I don't, well, then I'll worry about studying for it. No, it's going to cost you time and money in the long run. Okay. And on top of that, people may ask. People can look and see if you passed your exam on the first time. They may not can tell right away, but depending, on how long it took you to take your exam, people may make a guesstimate. If it's between you and somebody else for a job and they're asking about whether or not you passed that exam on the first time, you want to be able to say, yeah, I passed that exam the first time. Okay. On top of that, if you're sitting there with a job already and they're waiting on you to take your boards to come to work, it is really, really going to be not cool when you have to put off your start date because you didn't pass that exam. And you may very well be in that situation. So you have to block off time and say, this is my study time, just like it would be if it's your school time. And you're going to say from 4 to 8 on Tuesday, I am going to study this. And you're going to say exactly what it is you're going to study. Okay. Again, complete practice questions, make sure you're reading your rationales, take practice tests, and then do self-reflective practice and track your progress, okay? So how to create your priorities. Well, I've done this lecture so many times that you'll have to forgive me, but sometimes I jump ahead. So, you know, you already kind of know based on your predictor exam where your strengths and weaknesses are. And that is how you're going to create your priorities. Where you didn't do your best is where you need to start, how we discussed. And then you're going to rank them. Was it very challenging? That means it's a top priority. Somewhat challenging, middle priority. You feel good with the content, but still need to review. That's going to be the last thing on your list. Here's some things for you. Very challenging, top priority. Now there's a difference. Sometimes urology to me is not very challenging. It's just not something I like to do. So that's going to be somewhat challenging, middle priority. Neurology for me, I find challenging and I don't like to do it. So that's going to be my top priority. You understand the difference? There's a difference between not good at it and don't like to do and I kind of get it, but just don't like to do it. Okay. And then I could read journal content and things on pulmonology and cardiology all day long. So I'll need to review it, but again, bottom of my list. So I wish I had a better picture of this, but I've still not really found one. It's a little hard to read, but this would be easier in like an electronic calendar or even a paper calendar. But what you're going to do is you're going to take the calendar, a literal calendar, okay? And you're going to say, on Monday, I'm going to do 4 hours of study on the 1st. Like say, okay, so this is Monday the 1st, and you're going to do 4 hours. Sorry, there should be a line there or something. But on Monday the 1st, I'm going to do 4 hours. If I were you, I would actually say what those 4 hours are, like from noon to 4. And in that thing, you're going to say neurology, and you're going to do an hour of review and an hour of test questions or rationales, or 2 hours review and 2 hours of test questions and rationales. Okay. And then you're going to say, that's something I'm really not good at. I think I may need 2 or 3 days of that. Or I may need 8 hours of it. And so you'll schedule that for Monday and Tuesday. It depends on how long you've scheduled your exam out for. You know, you need to be cognizant of making sure that when you schedule your exam out, you've given yourself enough time to study. And so there's your 2 right there, right? And then say on Thursday, okay, on Thursday, I'm gonna go ahead and move to urology. It's not gonna be fun, but I'm gonna do it because I'm a good student and I'm gonna know this stuff and I'm gonna pass my boards on the first time. And you're going to make it for that day. You're going to say 5 hours. Okay, so from that day, from noon to 5. And you need to put it on the calendar, and you need to put it on a family calendar. You need to tell everybody, yeah, I'm unavailable from this point in time. You will need to sort out your own dinner. Okay? And let your husband know, let your significant other know that is your, treat it like work time. And then you're going to plot this out for the entire time. And you see there's even some areas for catch up right here at 5 hours. So say over here on Thursday, the 11th, you had 5 hours planned and oops, you got called into work or a kid got sick or it just didn't happen that day because life happens. Okay, well, you have scheduled a little buffer in there, 5 hour catch-up plan. Awesome, not off track yet. Okay, so, and then be sure you're giving yourself some brain breaks in there. You guys who like to sit down, and I know you're hard workers, but you're going to study for 14 hours, you're not going to retain any of it. Your brain is tired. It just lost everything. Really keep it to 4 to 5 hours, nothing more than that. Okay. Those 8 hour study crams, you're not retaining it. I know enough about neurology to know that you're not retaining it. Here's another little trick about neurology. There's a huge, huge thing. You create pathways by writing things down. And it's a different pathway than if you typed it or if you're reading it off a PowerPoint or if you're just kind of highlighting things on a PowerPoint. Writing things down creates a different pathway of memory. Do not underestimate the power of the pen and pencil to paper, okay? Seriously, write it down, make some flashcards. It just creates a new way to do it. I know people who will write it out, read it to themselves while they record it, and then listen to that on the car on the way to work. And you know what? You just created 3 different pathways, or 4 actually. You read it, you wrote it, then you read it to yourself, and then you listened to it. 4 pathways in which to memorize that information. Okay? So keep that in mind. There are a lot of different ways of learning things, and repetition is a great one, and creating different pathways in the brain is a great one. So developing some strategies for the exam, okay? Plan ahead. Don't let this be you. Keep calm and study for exams, right? So here's a big thing people really struggle on with taking these exams is that they think they know what the question is answering, but what actually it happened is that you started reading the question, you zoned out, thinking, oh, I know this, and then you're not answering what the question is asking you. So identify what the question is asking. Help select the correct answer and narrow down your choices. Okay, so critical to developing strategy because it's critical to develop a strategy because nursing exams, a lot of times all of the answers are correct. And what you need to do is pick the most correct answer, okay? And part of what doing that is understanding the STEM. That's what it's called, is the STEM when you're in the test-taking language. But it's essentially saying, what is the question actually asking? And that is why you read every single word in the question. I know for ANCC, we're not allowed to use nots. There's no select all that applies, things like that. AAMP has a little bit different strategy. And I think they do use nots. And that's a hard one for people, you know, what not to do in the situation. But make sure you understand what they're asking, read every single word, and then think about it. Okay, wait, are they asking me for a medication? Are they asking me for an assessment? Or are they asking me for intervention? Okay, so these are all going to be things you think about when you answer this test question. And I say this with the caveat of, don't think that just because you have some test taking strategies, you don't need to know the content. There is no substitute for content knowledge. There is no magic bullet. There's no magic way to be able to guess the correct answer. So do know your content, but we're going to go over some of the best ways to answer the question. So strategic basics. You're going to read every word in the question. We just said that. You're going to determine what the question is specifically asking. What is it asking me? Focus only on the information in the question. And this is really hard for you guys. I see a lot of people struggle with it. It asks you about you see the word hypothyroidism and you start going into your mental Rolodex about every single thing you know about hypothyroidism. And you're thinking skin, nails, hair, tired, weight gain, blah, 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 blah. And really, they might be just saying that you have a 36-year-old woman with hyperthyroidism and hypertension and this. And they're like, she has a urinary tract infection and she's pregnant. What is the answer? And you got stuck on hypothyroidism. And now you're freaking out and you're like, she's hypothyroid and pregnant. Da, da, da. Really, actually, that was all just filler. They actually just want you to know how you treat your tract infection in a pregnant woman. Okay, so watch for that. Focus only on the information in the question. Make sure you read every single word. Don't let your mind go off into the ether, coming up with everything you know about that. Look for the strategic words or phrases in the questions, and then prioritize all of the choices that may seem correct. Because remember, you got to pick the best answer. And I know in your world, especially if you come from the hospital world, you'll get something that asks you about bleeding, and it's going to say, well, do you want a H&H, a CBC, or, you know, a BMP or an iron panel? And you're like, well, I want all of them. The H&H is part of the CBC and da, 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 da. But what, if you could only pick one, what do you need to know? You need to know what that blood count is, and that's the H&H. Make sense? Like, I know that in your real world, you would get all of those things all at once, but that's not how the test works, okay? So look for some keywords. Examples of keywords: immediate, initial, first, best, priority, side effect, and toxic effect. And you'll see those a lot in your pharmacology questions, okay? When you see toxic effect and side effect, you know they're probably asking for a med. And then remember your ABCs or your CAB rule, whichever one you like to use, but airway, breathing, circulation. You gotta keep them alive, right? So which of these things, if you didn't do, would hinder their ability to breathe, their body, their heart to pump, or to maintain an airway? And part of the way you can go about that is called thin thinking. So, and they call it thin thinking so that you don't go into that overthinking process, right? Keep it simple, stupid is how I think of it. But think about the patient presentation that they've given you. What would your top 3 priorities be for this patient? If it is airway, breathing, circulation, then you have to think, help, quick, act now. Your answer is going to be something that requires you prioritize or do something immediately to save that person's life. If it is not a life-altering thing, if it's not acute, then you're probably going to head into identify the risk or safety concern. Say a mental health patient. They're presenting to you with depression and they're going to give you a scenario. Well, am I worried about suicidality in this patient? Well, we're always worried about suicidality, but is this patient showing signs of self-harm or are they just complaining of some anhedonia? Okay, just anhedonia. Well, then, you know, we want to make sure that we ask about suicidality, but we're not thinking that they're doing it right that second. And then do no harm. Remember, always think about the toxic effects. Make sure that whatever you're doing is the least invasive and that it could not have a toxic or potentially adverse effect for your patient. So if you're in your thin thinking and you get to the help, quick, act now, and it looks like this is super acute, well, if there's plenty of assessment data in the STEM, so they gave you all the vital signs, your labs, everything in the STEM and everything you already need to know, and you kind of already know what's going on with your patient, say they're in neuroseptic shock, then they're probably looking for you to act, and you're going to see a word like implementation or intervention. And if it looks bad, you're going to provide care. You're going to provide some sort of intervention for that patient. So don't get caught up in other things. Think, they gave me all this information. I already know what this is. Okay, what am I going to do about it? If it looks bad, you act and provide care. If they give you kind of a general question, but you don't have all of that data, then you're probably looking at a question that's asking you something about assessment. It's going to say, ooh, I have this 36-year-old woman. She's got a fever and she seems to be lethargic presenting to you. You're like, okay, I need to know more than that. And that is where you're going to do an assessment and gather assessment data. Now that may be labs, that may be how you listen to lungs, that may be, et cetera, but you're looking at an assessment. But the thing to take away is if you have all the information you need, then you're probably making a judgment call on what to do with the patient. And help, quick, act now is your response. And it's doing the thing that's the least harmful and that has to happen right that minute. And remember, when all of your questions are correct, which one of those is the thing that you have to get right that second, that it matters. And that's, you know, if they're bleeding out, it's other than finding out where they're bleeding from, it is your blood count, right? Yes, you want all the other stuff, but we can worry about their iron level later. When it's time to replace that, we need to know what their blood count is right this second, because we have to decide whether or not to give them blood. And if you haven't gotten vital signs and that's your person, well, then vital signs is your answer right that question, right? Because you need to know if their blood pressure is 120/60 or if it's, you know, 60/40. Okay, so chronic versus acute. So if they are presenting you a question that is urgent, acute, and sudden onset, sorry about the typo, then you're going to have a priority action, right? If it's chronic, long-standing, and slow changing, that's going to be a different kind of patient. And people kind of don't take that into account, especially people who, you guys who work in the hospital, you see everything as acute chronic. It's like, well, what would I do right this second? Or are they crashing on you? Or are they presenting to you? And yes, you got all this data. They have a history of congestive heart disease and COPD, and they've been a little short of breath. It's been getting worse over the last few days. Well, if their oxygen level is at 96, we're not in an acute situation, right? We need to decide whether or not they might be headed into a COPD exacerbation, or if maybe they're getting a little fluid overloaded, but you're not trying to intubate them, okay? So remember that. Take into account what they're giving you and pay attention to the vital signs. Is it acute or is it just they look bad on paper and they could be acute, but they're not crashing on you yet? Not everybody is in shock. And can you determine the timing and urgency of the situation, which is what we were discussing. The next thing is always choose the least invasive method, right? Consider what it is you can do for this patient that is going to have the most immediate positive impact, but is not super invasive. If that CHF COPD patient is, you know, dropping their SATs, and they're telling you you're listening to them and you're hearing fine crackles in both bases, and they're starting to get a little more short of breath, well, you're going to start an IV and give IV Lasix. If there's just a few fine crackles, but they're holding their SATs, they've got a little bit of lower extremity edema, you'll probably give PO Lasix. You know, so for, you know, I know in the hospital, everybody gives IV everything, but that's not always the answer. And it's definitely not always the test answer. Okay. And then also consider what's delegatable, right? You are no longer the nurse in this situation. You are the provider. So stop being the nurse. Don't think, oh, I need to make sure and put that chest x-ray in. No, you're going to delegate that, the vital signs, to the nurse and all that other stuff. And then you're going to go read the chest x-ray. That's your job. So remember what's delegatable. Remember what the nurse role is versus what your role is. And you are now a nurse practitioner. And I say that it's really easy. It's really easy to want to fall back into what you're comfortable with and what you know. But you have to remember you have a different role now. Okay. So you are now a nurse practitioner. Congratulations. You're here at your one-day event and you're like that close, man. You just got to pass the certification exam. So, okay, continuing on. And delegation. So now with your new little nurse practitioner license, you can delegate. Just remember you're responsible for what you delegate. So consider this when you're taking care of your patients. What are the client's needs? And then match those with the scope of practice of the healthcare provider identified. You will get delegation questions on your test about what is and is not safe to delegate and what is and is not safe within your scope of practice. And remember, when they're talking about scope of practice, they're not talking about what you can do in your state. It's national scope of practice, because these board exams are national exams, right? They're not state exams. So it's scope of practice for your field of being a nurse practitioner. So what is safe for you to do? So pharmacology questions. Focus on the information, like the medical condition in the question. And then always remember your classes of medications and what system it impacts. So think about this. If they have hypertension and you're thinking, okay, what about an ACE? Well, what do you got to think about when you're thinking about an ACE? Well, I have to think about heart failure. I have to think about the kidneys. I have to think about the renin-angiotensin system. So you have to remember what all they affect. If you start thinking about beta blockers, okay, what do I have to think about that? Well, they cause afterload reduction. If my patient is in acute congestive heart failure, I don't give them a beta blocker. If they're having an MI, I do. Affects COPD, affects diabetes. You have to think about all the things that it could affect. Okay. Multiple choice questions, and this is an important one right here. And I see people fail at this one. Not fail, that's not nice. But get stuck. So if you have a multiple choice question, right? And you're getting to look at you're like, I'm not completely sure. You know, it's asking you something. I'm always going to go to a cards situation here, but they're asking you something about hypertension. And you're looking at, your answers are sotalol, atenolol, metoprolol, or lisinopril. Well, they gave you 3 beta blockers and an ACE. It's likely not the 3 beta blockers, right? Because they are covering that. It's the ACE, the one off, the one that's not like all of the other options. This is going to be your correct answer likely. So look for options that are comparable or alike and eliminate them. If you get 2 of the same thing, it's probably not those 2. It's probably something else. Watch for closed-ended statements, because they tend to indicate that only that an option is incorrect, especially if the communication style is with quotation. So watch for things like always, never, only. So that tends to indicate that there is an option that is incorrect. Does that make sense? I know it's a little bit of a turnaround. I'm trying to think of an example. What would you never give a pregnant woman with a UTI? And it's going to say amoxicillin, nitrofurantoin, or Bactrim. Bactrim is the one you never give, right? It's the one that's the incorrect answer. Like if the answer was different, if the question was different, like what would you give a pregnant patient with a UTI in the first trimester? It would be nitrofurantoin would be your best answer. But when it says never, remember, it's going for the one that's bad. So never, bad, Bactrim. Delegation guidelines. Generally, remember that you can do non-invasive things to your RN or lower, LPN, CNA, etc. Skincare, range of motion, those sorts of things. Remember what a licensed practical nurse can do, and of course, you remember what a registered nurse can do. Remember that everybody should work to the full scope of practice of their license, and make sure that you're holding people and teaching them to do that. What's going to happen to you a lot is that you're going to have nurses come up to you and be like, hey, so-and-so has red skin on her bottom. And you're going to be like, okay. And they're going to want you to come look at it and do the rest of it. And you're like, okay, well, can you chart that? And is it blanchable, not blanchable? Like, go assess it and come back to me. Because what's going to happen is the CNA is going to have been bathing them. They're going to come and tell the RN that. The RN sees that you're already here. Instead of taking time out of her day to go assess the problem, they're going to come tell you and want you to assess the problem. No, have them do their job, chart it. That way, when you chart it, you can say measurements per RN. Because it's not your job to go in and measure it and do all that stuff. It's your job to go in, look at it, and determine what needs to be done. Whether you're going to prescribe a barrier cream or you're going to have to do something more if there's slough or whatever. But just remember to put that burden of assessment, not that you don't assess your patient, but that initial assessment for something that's non-urgent, back on your nurse, okay? Everybody can work to the full scope of their practice. Okay, this may be the most important slide out of the whole thing because you all do it. Raise your hand. I don't do it. I'm not a doer. I don't do this. But most of you, not most of you, but a lot of you love to like flag every question and go back and review it and get overly anxious and change your answers a billion times. And you know what? You're more likely to get it wrong if you do that. Don't do that. Your first instinct is usually best. So follow good testing practices we just did, make a decision, and stick to it. The only time you go back and change an answer is if you read something later on that says, oh my gosh. I mean, it's all happened to you before, right? Like you get to a question like 4 or 5 down the line, you're like, actually the way I answered that, like this is the answer to the question 5 questions back. So then go back and change your answer if you got it wrong. But if that's not what happened to you, do not go back and change your answer. It will be wrong. That is statistically proven, okay? So that's the only time it's okay to go back and change your answer is if you get further on along the way and you're like, oh my gosh, that's the correct answer. I just read it in this question. Then you go back and change it. If you didn't, don't. If that's your habit, stop it. Now, I want you to tell yourself over and over again, I will not change my answers. I will not change my answers. I know this material. I trust my gut. I will not change my answers. Okay? Select all that applies. So I'm going to be brief with this because as far as I know, ANCC does not have select all that applies. I know AAMP is considering them, but they have not instituted it yet. So we'll touch on it briefly. This is in the NCLEX, but not with us yet. So how do you approach a select all that apply? You have to remember that all can be true, that no less will be correct typically. Because if we select all apply, why would it only be one? They're telling you there's more than one answer correct. Read each of them like it's a true false. So each answer differently and ask yourself, is this true or is this false? And if it's true, click it. And that each answer stands alone. Again, it's like reading each one and answering it the same. And then there's no partial credit. Either you get them all or you don't. And these are usually higher level questions that are trying to determine it takes a lot of critical thinking to answer those. Like I said, I don't think they're on our test yet, but just in case you come across one, remember, treat each answer like it's an individual thing and ask you, okay, is this true or is this false? And then make sure you understand what the STEM is asking you. What is the question asking you to determine? Make sure there's no not words in there that are going to turn it around on you. If there's not words in the question, I try to read that question and I read each answer individually to determine if that works or not. Another thing I do, and actually you won't find this as like this goes a little off the grid and it doesn't have anything to do with the slide. But if I'm the kind of person that tends to go like read partial of the question and goes off in my mental Rolodex of everything I can remember about that. If you are someone who does that, what I really want you to think about is there's only 4 correct answers, you guys. There's only 4 correct answers, and nothing sucks worse than knowing you know the answer to this question and you get down to look at the answers and none of them are the answer that you had in your head, right? And you start panicking and you're like, oh my God, I don't know the answer. And maybe I didn't understand the question. And then you read the question over and over again, and your anxiety goes from here to here and it all just, so if you're the kind of person who routinely does that, and I only recommend this if you're the kind of person who routinely does that, then I read my answers first. I cover up the question. I read my answers first. And then I go back and I read my question, knowing that those 4 answers are the only 4 answers that can possibly be. Okay? And if you don't need to cover up the question or whatever, or if you need to read the question and look down at the answer before you come up with it in your head, do that. But just remember, those are your only 4 answers. That's all there are. Sometimes it might not be the best answer you think it might be. So it's important that you remember there's only 4 correct answers. And if you're going to go way off into the ether thinking about everything you know about that particular subject and spend a lot of time doing that, then it might be worth your while to read your answers first and then your question so that we're going into it knowing exactly what it is you're talking about. Okay, back to the slide at hand. Ask yourself, identifying risk or safety concern. So ask yourself if the question has safety implications. If it's something that you don't do, is it going to hurt your patient? If it's something you do, is it going to hurt your patient? Is it a life-threatening or potentially life-threatening condition? Like my patient has a SAT of 76. Is it life-threatening if I don't intubate them or put them on some kind of BiPAP? Probably. So then you're going to intubate them. That is the least invasive thing, or they're going to die. Would another patient be endangered if this task is done now or if the task is left for later? So if they're giving you the option of you have 2 patients and neither of them are doing that good, but one has SATs in the 90s and one has SATs in the 70s, well, take that into account. Even if they're going to make the one that has the SATs in the 90s, clinical picture look worse on paper than the one over here, but you've got to concentrate on the one who's crashing on you. And then is this task or process essential to the patient or safety of the patient? And then, those are your priority questions, risk or safety concern. Usually I tend to see you guys have that. Okay, provider process. And we went over this a little while ago, but it's worth hitting on again. Watch for terms in the question that are going to help you determine what it is you're trying to answer. Okay, if they want you to do an action, like order a lab, intervene in some way, then it's usually going to say either assess or intervene. And that is asking you to do an action. If it is asking you something that includes gathering more data, then you're going to be assessing. If it's implement, it usually means a intervention, provide care rather than assess. So implement or intervene, you're going to be doing something. If it says intervene, you're going to provide care rather than assess. Okay, so if it says action, you're going to assess or intervene. Assess, you're going to need to gather more data. Implement an intervention, provide care. You don't assess. It means it's time to act. Intervene, provide care rather than assess. So this is advice from a fellow student, and this actually has to do with the Q banks and the 3P exam, but I leave it in here because it's worthwhile advice in regards to any kind of test. Not worried about purchasing Q banks right now, except for if you're in family practice, the patient management Q banks are really great, and those you probably just had, but they're worth doing. But whatever you're doing as far as taking test questions, practice test questions, do it over and over again until you're getting it 75 to 85% correct on all of them. You want to be making that, like, actually it's 78% to 80, is kind of the national standard, 78% correct on all of them. Purchase flashcards. If you're not great at, especially if you're struggling with farm flashcards are great. If you have pharmacology flashcards, you can take them with you kind of everywhere and always have a few to look through. Because you spend plenty of time waiting, whether you realize it or not, waiting on your kid in driveline, waiting for a doctor's appointment, etc. Even if you only do a few flashcards at a time, that's a little bit of studying here and there that you're doing, right? And I had just put their $29.95 on the APA website. Hollier Certification Study Book is great for FNP practice. They went through the practice test and they did a little bit every day. Those are board style questions. If you're in ACMP, then I recommend Barkley or Board Vitals. They did the Q banks. That's what I was talking about. If you're FNP, the Q banks are great. And then they also have a couple of predictor exams. And then if you're ACMP, they have DRTs. Those are diagnostic readiness tests, and you can buy those. And I would wait until I had done my studying rather than kind of wasting my money before then. But before I went and took my test, I would purchase one and see where I'm sitting at, because it'll be a good idea of where you're sitting at and whether you're ready to take that test or not. And then going back over your notes, doing the prep lectures, board prep, and that's usually like Hollier is FNP. She's not the only one. She's not the only one and only. There's several out there for FNP. I'm just the most familiar with hers. And then doing Barkley is, like I said, the gold standard for ACMP. And then studying several hours a day. But remember, don't go crazy. Okay. All right. Well, questions. If you have questions, I am Melissa Sarhan, melissa.sarhan@gcu.edu. I think Stephanie and several of the other faculty will be on here also, and they can help you with questions as well. Good luck, you guys. Congratulations on getting this far. I know you're going to do great, and enjoy being a nurse practitioner. Bye.